Today I am here with Dr. Lavu from Thomas Jefferson University. Dr. Lavu is a pancreatic surgeon who has done a ton of medical research, which we will be learning about today. So my first question for you is, why did you go into medicine? Why did you choose to be a surgeon? And specifically, why hepatopancreatobiliary, that big word, and what does that even mean?
Well, first of all, thank you for the privilege of being on your podcast.
Of course.
Pleasure to be here today. I went into medicine because I wanted to have a career where I could help people in my day-to-day job. And medicine is one of those fields where you really have that ability. So that was why I chose medicine. Surgery I went into because I enjoy working with my hands. And surgeons, you can think of them, they're in a category of people like plumbers, carpenters, artists, people who work with their hands every day. And so surgery is not only can you help people, but it's also fun.
Yeah. And so describe your job a little bit. What are some of the main tasks and responsibilities at work? And like what's kind of a day in the life?
So I work at a big hospital, Thomas Jefferson University, and so I'm on the faculty there as a professor. And so we call this academic medicine. And the mission of academic medicine is to provide care to patients. Okay. Most doctors do that. But then there are a couple of other missions. One is to advance the field forward, um, innovate, make new discoveries, figure out how to do things better to help patients and improve the field. And then another component is teaching the next generation of doctors and surgeons and training them. So all of those are different facets of my day to day.
Hmm. Wow. And so what things have you enjoyed about your work and your work life? And what parts of it do you love doing? And kind of what motivates you every day to get up and go to work?
What motivates me are my patients, being able to help them, um, and my trainees, the medical students and the residents that I get to work with young people every day. So that's fun. And teaching people about the art of surgery. Um, those are the things I enjoy the most. I enjoy doing research, and most of my research I do with medical students and residents and fellows. Um, and um, so I think those would be the things that I enjoy the most. Surgery though, it's a difficult field, and cancer surgery as well. You know, most of the patients I operate on have cancer, so it's challenging. And you can kind of look at a challenging career in two ways. One is it always keeps you interested. You have to work hard all the time. There's no mailing it in. And that can be very motivational. So for me, that's very motivational. I'm always trying to get better. So surgery is a field where you're never done learning. You could be doing it for 30 years, you're still learning. And so if you like learning new things, medicine is a great field and surgery is a facet of that is a great field. But you know, the difficulties that I don't want to gloss over the difficulties. It's hard having conversations about cancer. You know, it's hard when patients don't do well. It's difficult when you're not able to offer someone a treatment that you'd like to, you know, but it wouldn't be right. And then, like any good thing, it can be difficult hours. It could be lack of sleep sometimes. It could be missing family events if maybe you have to be at the hospital to care for someone, but on the other hand, you're missing a family event. So there are certainly trade-offs.
Yeah, of course. So you kind of touched on what things frustrate you and the difficulties. What kind of stresses do you encounter as a surgeon?
I think that the stresses relate to you want to do a perfect job.
Mm,
The best surgeons are perfectionists. They want to be perfect.
yeah.
But being a perfectionist is not necessarily healthy for one's psyche because human beings are fallible. We make mistakes. And not everything in medicine is up to our control. Even though we'd like to think it is, it's not. So a lot of the stressors relate to just wanting your patients to do really well and working really hard towards that. And so that takes a certain amount of uh, hard work, being detail oriented, being a good communicator. So there are a lot of skills that are required if you want to be a good doctor. You need kind of a wide skill set to do a really good job.
Yeah. And so I understand that you have produced many research publications with the help of trustees and residents and done a lot of clinical trials relating to pancreatic cancer. I want to understand like what kind of motivates you to do this research and have you ever seen the impact or results of your work in the world around you?
Yeah, pancreatic cancer is one of those diseases where we've made a lot of innovation, but there's still more work to be done,
Hmm.
much more work to be done. It's one of the things that made me interested in this field. I wanted to be in a career where I didn't want a career where everything was already figured out.
Yeah.
I wanted to get into a difficult career where I could make a contribution and try to make things better for future patients. And so the research that we've been engaged in relates to sort of different categories. There's one category would be improving surgery, doing complex surgery better, caring for patients better, improving their outcomes. That would be one category. Another would be trying to use new types of therapies to improve the outcomes, long-term outcomes of pancreas cancer patients. And that could be things like new chemotherapies, new types of ways of doing radiation, novel immunotherapies. And so we've done clinical trials in all these different areas where we're trying to reduce the chance that the cancer could recur. We're trying to prolong life and the quality of life for our patients. Um, those are like a couple of the big sort of areas of research. And one of the things when you conduct clinical trials, you have to you have to be like a very sort of inquisitive person. You have to be very intellectually honest. What I mean by that is you could design a trial that you believe in and spend years conducting the trial to
Yeah.
find out 5 years later, this new thing that you're so excited about, it turns out doesn't work.
Mm,
And so if you get upset and frustrated by that, this may not be the right field for you because the majority of clinical trials end in failure. But
yeah.
what you're trying to do is learn more and more, and eventually make breakthroughs. And we've had a number of trials that have made significant impact in the field of pancreatic cancer and surgery and things like that. So that when that does happen, you can imagine it's incredibly gratifying.
Mm, yeah. And so I also know that you like to do a lot of lectures and teaching, on various topics such as, medicine in general, hepatopancreatobiliary surgery, pancreatic cancer. What inspires you to teach others, and what is the power of teaching?
Well, I've been very, very fortunate because I have been taught by some of the real experts in this field over the course of my career and my training and so on. So I feel an obligation to pass that forward. And all of the knowledge that I've been given and the experience that I've accrued through my career, it's great if I can apply it, but it's even better if 10 more people can apply it if they can learn. And
Yeah.
so that you can then affect not just your own patients, but then other patients, and it can spread. So that's where a lot of the teaching comes into play, but then lectures, going to meetings, national, international meetings, being invited as a speaker at different places. What that is that's an opportunity to share your experience with other people.
Yeah. And so, are there any expectations that you had about your career that turned out to be different from reality?
Um, that's a good question. I think of myself as being really, really lucky because the thing that I set out to do 20 years ago, I'm actually doing. And
Yeah.
that's like really neat to me. I have to pinch myself sometimes to think that, 20 years ago, this was something that I dreamed of, and I'm actually doing it.
Yeah.
I will say though, like, it's hard, like it gets easier, but it's still hard.
Mhm.
And that's what makes it interesting, but that's also makes it challenging as well. And the type of surgery that I'm involved in related to cancers of the pancreas, the liver, the bile ducts, the gallbladder, these are surgeries that it takes years to learn how to do these, and then it takes years to perfect the technique. And then even when you think you've got it all figured out, things still don't always go the way that you want. And so it's always you never take it for granted, I guess is what I would say.
Yeah. And so, did you pick or did you just kind of find yourself doing hepatopancreatobiliary surgery? Like, how did that come to be?
I was inspired by a mentor of mine at UCLA who was also an HPB surgeon and a specialist in pancreatic cancer, and really one of the foremost experts in the country. And I was inspired by watching him in the operating room, and then being with him on rounds in the hospital, and then meeting patients in the office. And you can imagine when you're talking to folks about cancer, that's a very kind of unique thing. It's a difficult thing. It takes a special kind of person who would want to do that and who's good at doing that. And if people are good at doing that, it is such a wonderful service to the patients to be able to comfort them. So I was inspired by a faculty member, and that was when I decided, this was the field for me. And then I took steps to pursue that field through additional fellowship training, and then joining Thomas Jefferson, where there was already a very large program, a prominent program in this field, and being able to join the team here.
Yeah. And so, what advice would you give someone who eventually wants to be where you are, or what's the best advice that you've gotten on your journey to being where you are now?
The advice that I would give is that careers in medicine are wonderful, fulfilling careers. They're worth it. They're not without some sacrifice.
Mm.
Um, and I guess what I would say is that you're never done learning. And the training, the education, it's long.
Mm.
So what you do is the secret to doing all that is to continue to live your life and enjoy and do all the things you want to do while you're pursuing your career. Don't have that philosophy that, well, when I'm done with this, then I'm going to do X, Y, and Z. I
Yeah.
say just do it all at the same time.
Yeah. Well, that's all the questions I have for you today. Thank you so much. I have learned so much, and yeah, I can't wait to hear what you do next. Of
Well, it's been a pleasure being here with you today, and I just wanted to thank you for this opportunity to have this chat.
course.